Oh, hi, I'm Laura. I work at Barca in Leeds, and we have a children and young people social prescribing service that operates in the west and the south of the city.
And I'm Philippa. I work at Yorkshire Health Partners, which is in East Riding. And we have a children and young people social prescribing team as well that works across the East Riding. And also we do have a social prescriber that works with care leavers in Hull. And we thought we'd come here today to talk to you a little bit about children and young people social prescribing and why we think it's such an amazing thing, and really would love for it to be universally available to all.
Yeah.
So today we're here to talk a little bit, aren't we, about social prescribing, especially for children and young people, and the impact it has on their lives. So I guess it'd be really interesting, Laura, to hear from you what you think, how you would describe what social prescribing actually is.
Yeah, so I always describe social prescribing as a connecting service that it enables young people to I guess journey from where they are now, but into then and connected to services in their community. So it's that kind of support to overcome any anxieties, or to overcome just the knowledge of what's out there. Sometimes there can be so much out there, but we just don't know where to look and where to start. It can be quite overwhelming. So it just helps in that bit of finding somewhere to go and then actually getting there as well, and being comfortable to attend.
Yeah, like linking them in with what's already out there. We're not trying to create something new, are we? We're just trying to create
No.
meaningful connections for them so that they feel confident, and even supporting them maybe to start with to go. I come from a medical background, so I try and see it as it's not a it's a different type of prescription is how I would describe it. It's a social prescription to sort of like support them with some of the needs that they need addressing and that they want to address through a social prescription, as opposed to a medicalized prescription, which we do very often in healthcare services. We're very keen to look at what we can prescribe, what we can give to make somebody better, but actually that's not what's needed. Sometimes it is, as you say, linking a young person into services in the voluntary sector, community sector, and statutory services that are already out there that they maybe don't know how to map and find out about. And it's about our social prescribers have those connections themselves, and they've already linked into all of the services, haven't they, so that they can actually they can recommend services, and they can talk with the young person and say, well, this might help you, or that might help you. And then they can go with the young person if they don't feel able to do it on their own, and support them initially to get them into those services that they wouldn't have maybe otherwise accessed.
Yeah, and I think community is really important within that, because like I've been trained a lot in the 5 ways to wellbeing, and so in those you've got obviously to keep learning, to give to others, physical health, emotional wellbeing, health. But that connection to community and that relationship with others is all a real key part of that. So the social prescribing really just unlocks kind of that ability to kind of look at those 5 areas holistically. And I don't think there's community is out there in pockets, but it's not always easy for everybody to feel like they belong to a community, or to know what their community is, and what's available in their community. So to have somebody as a help and a guide to get them to think about that for themselves, and then what they want to do, I think is a really crucial role to kind of link people up to services that are already in existence. I think it's that bit around not inventing something new, but like you say, really connecting into what's already there and helping people to access it and make use of it.
I totally agree, Laura, and I think that goes back to Maslow's hierarchy of need, about a need to be needed, and the need to connect. If we want to take it to the back to the social aspects of it, but yeah, I think social prescribers, just as you say, have that ability and that knowledge frame to be able to link a young person into individual groups in the community that they might find enjoyable, and actually give them another outlook on life apart from just school, home, and such like. Because I think as a society we've kind of moved away from connections a bit, haven't we, really?
Yeah, which I think is probably a nice link into, I guess, another thought, which is, what's the difference between children's social prescribing and adult social prescribing then for you?
Yeah. So for me, I think adult social prescribing, it's a lot more about the adult taking themselves there and connecting themselves in. I think an adult will go to a social prescriber to find out what's going on locally, to find out where they might get support for financial help, where they might get some support for employment, a whole host of many different things, as we said, like a full holistic approach. But they are very much often left to then make those decisions themselves about where they want to go and introduce themselves into the group. I do know some adult social prescribers do work alongside some adults and take them in there. But for children and young people, I think it's absolutely paramount that our social prescribers have that ability to spend that time with that young person to help them explore what is important to them. And that's where we use a what matters to you approach. It allows them to really be heard sometimes for the first time, and it's really important that we connect with them and almost become a trusted adult. I think young person social prescriber has that time to connect with them and then can build a relationship and take them as a sort of like a trusted adult to try out a new place, like maybe a youth club or a climbing group or a arts and crafts group or a drama group, whatever it is that the young person identifies that they might be interested in doing. And it's a trusted face there for them so that they don't feel totally misplaced when they move into going to try something like that. Sometimes they can even work with them for a period of time before to help them with their anxiety, giving them tools to manage it or something like that, or building their confidence, whatever it is that the young person might need to help them there. How about you, Laura? How do you feel that works?
Yeah, I think for us it's that ability to put the young person first and to also advocate for them, because I think unlike adults, quite often young people also have to, I guess, not put first, but have to think about kind of what else is going on in their lives, in terms of it might be an adult that's saying, no, you can't go to that, or that isn't possible, or they've got to go to school during the day. There's certain things they have to do and certain places they have to go. So I think it's that ability to understand that context, that there's some bits and things that they have to do as children and young people, and support that they have to listen to, but also then that within that they've got their own voice. And I think that what matters to you is really important as well. I always find that actually if you ask a young person what matters to them, and you're able then to support that to be shared with parents or with school, that actually they get a much better understanding. And sometimes it's about how it's framed rather than what's said, and that it really helps them to find the words. So sometimes they don't know what they need to say to people, and they're struggling to kind of communicate what it is that they need. So to have that space to really kind of think about that, I think is really helpful for them and helps them feel in control and to have some choice over, because we all need choice and control if we want to feel good about ourselves and we want to really connect and make changes that will improve how we feel in terms of our physical and mental health. Then we need that choice and control. And I think working in a young person first way allows them to experience that, and sometimes for the first time.
Absolutely, yeah. I know a lot of young people express it as almost having a trusted adult, and they actually feel heard for the very first time. Because I think as parents, as adults, as teachers, as anyone that works with young people, we don't intentionally do it, but it's very easy to think what's best for that young person. And I think sometimes how yourself, if somebody tries to tell you what's best for you, are you going to necessarily do it? I know me as a quite a stubborn person, being a typical Tory, then that I probably wouldn't, and I'd be like, no. Whereas if actually somebody took the time out and actually gave me an opportunity to explore what's important to me, because I don't know about you, we use a number of tools such as the young youth star and different, there's lots of different tools you can go out there that you can use out there that helps a young person to look at different areas in their life to try and understand what they feel is important to them. You get a much better outcome if the decision comes from the young person themselves than if it's being told to what to do. Again, as I say, we're very good at doing that as adults, I think.
Yeah, no, absolutely. And we use Outcome Star as well, and it just allows young people to really think about each different bit of their life, because sometimes they know that they don't feel great, but they haven't always been able to identify what it is that's impacting them. But by being able, because the Outcome Star looks at five different areas of their life. It looks at kind of where they live, what their friendships are like, how they feel about school, how they feel about themselves. And so actually it allows them to start pinpointing things for themselves in terms of what's impacting, but also to grow that self-reflection and that self-awareness, so that going forwards they can be more self-sufficient in that self-care and kind of begin to recognize patterns for themselves. And so next time when they come across something that makes them not feel great, they know kind of what to do to try and understand, well, what doesn't feel great? What do I want to do about the fact it doesn't feel great? Okay, what am I going to do next? And they're able to kind of put that kind of, I guess, that thought process into action.
I agree. It helps them build resilience for the future, doesn't it? It helps them to become, as you say, a reflective person, to sort of be able to self-manage some of those not quite so difficult things. Fully appreciating that young people still might need to reach out for further help in the future as they grow, but actually, if they're empowered to be able to make some of those thoughts themselves and come up with some solutions, it makes them feel stronger as a person, and it builds their resilience, so that as they grow and face the real, the work world, things that happen in adult life, hopefully we're able to give them some skill sets that they can take with them going forward, and they will be able to manage a little bit better. That's what I think is great about social prescribing. It's such a strong early help type tool, an early resilience building model for young people. Can I ask, Laura, have you come across any issues with not issues, but what do you have to take into consideration when you're working with the young person's family as well? Because obviously that's another difference, isn't it, between adult social prescribing and children and young people social prescribing. We kind of, as an adult, we don't have to necessarily think so much about the wider family, but with a young person, there's parents involved, there's siblings involved, there is a lot more involved. So how have your team managed that?
Yeah, definitely a lot more involved, and it's quite age dependent as well in terms of some of the strategies you have to employ sometimes. For a young person under 11, we definitely try and include the parents. And so you're kind of trying to build lots of relationships and trying to kind of understand both what the young person thinks and feels, but then also trying to get an understanding from the parents as well about how they're feeling. And sometimes there's, I think if parents haven't had the best experiences with kind of statutory services, or it takes a bit of trust to kind of say, oh, actually you are here and you are here to help us as a family. So quite often we've had to spend a bit of time building up that trust and that rapport. And it's quite often we're then supporting parent issues. So it might be that we do a little bit of signposting to parents themselves, because it's actually them that need a bit more of support and a bit of confidence, so that they can almost then pass it down to their child or young person, or if it's something that's impacting. So we've had a family where the young person was actually a bit older, but the impact was financial status at home. And so we could do a little bit of work with the young person, and we connected them into community activities, so that they felt that they were getting access to opportunities, because money was tight, so they needed to access free kind of provision and free activities. So they got into the summer holidays program, but their anxieties weren't going to go away while the family finances were tight, because the family were having to make difficult choices. So actually what we had to do was build up a relationship with the young person, so the parent could see that we were on their side. Then the parent learnt to trust us. So then we will be able to pick up with the parent whose mental health was slightly impacting on their ability to kind of seek support for themselves. And then they were given enough confidence to get engaged with Green Doctors, which is a financial support service. So they were able to then to budget, and it just kind of changed that dynamic more long term. So we could have just worked with the young person, and their anxiety would have improved in the immediate situation, but it have kind of kept coming back as those family finances weren't resolved. So being able to work with the parents as well really kind of brought that more sustainable resilience and change. But equally, if a young person's older and kind of has their own confidence, has their own competency to understand and make choices for themselves, then we might just work with the young person. If the parent isn't ready to engage and doesn't feel like they're able to open up, then wouldn't want that to preclude the young person getting help and support. So it's kind of real individual, and just really kind of taking each family as a family themselves and understanding their story, their dynamics, and what's worked and what's right for them.
I would completely agree with you there, Laura. Totally. Yeah, I can echo what you're saying about supporting a family where it seems appropriate. We've had a young person who was referred to us who had a potential autism diagnosis, was waiting for that, but mum also had mental health problems herself. So we sort of supported her to get support to help her parent. So she felt more confident to parent the young person. And we were able to support them into something called Matthew's Hub, which is a local charity that supports families and young people waiting for an autistic diagnosis. So that it fully supported the family around the family again. So it meant that, and the young person was able to have activities through Matthew's Hub and joined other activities, but parent was able to get support as well. Mum was able to get support. So it meant that everyone felt supported, and as you say, is so much more sustainable. I will just say another area we sometimes find as well is that parents can have different goals that they think their young person might need. So it's working really carefully with the family and with a young person to try and align those goals, so it doesn't feel like the young person is being told what they need to work on again. And sometimes when you speak to parents and you say, well, this is what the young person's identified, you might find that if we work through these, that will enable the young person to feel better about what you feel are your concerns, and they're open to it. I think as you have, as like you say, as long as you have open and honest dialogues with them, then I think you can bring the whole family on board. And the same as you as well, when we've got an older young person who's definitely competent and it's very clear that they don't want the family involved, we openly encourage them to try and speak to their family about it. But there are a few occasions when sometimes maybe you can see why they feel concerned about bringing the family in. So we would respect their own individuality and what they wanted at that point and work alongside them, but always encouraging them to speak to the parents themselves to bring them in and feel more supported. So it is just us offering that support.
Yeah, no, absolutely. And I think it takes a lot of flexibility, doesn't it, on the staff's point of view, and a lot of confidence on the staff's point of view sometimes to be able to have those conversations. So I don't know what you found in terms of training, but obviously at the moment there isn't a recognised qualification for children and young people social prescribing. There's some qualifications for social prescribing in general, but nothing that hones in on kind of some of these nuances of children and young people. So I was wondering what you found to support your staff as they develop in these roles.
We do ask them to do the general training, because I think it gives some really good ideas around social prescribing, what it is, because obviously a lot of staff have never done social prescribing before they come to post before, so they like the idea of it, but to really understand what it really means, I think it's a really good basis. But I think a lot of it is we've kind of individualized training to their individual needs, so like looking at trauma-informed care, first mental health, first aid, I think it's really important, suicide prevention, because ultimately we find 95% of young people that are referred to us are for emotional health and well-being reasons. We've looked at compassion fatigue as well, so that a social prescriber is aware of when they might become, they might have had too much in one day. We also do a lot of supervision as a team, so where they have the opportunity to talk about cases, to talk through what's going on for them, to get other people's ideas, see if people have come across it before. I think that's really powerful, peer supervision, like action learning sets and things like that. Safeguarding supervision is another one that's really, really needed. So they've done their level 3 safeguarding adults and children, because obviously we deal with sometimes adults as well as children. It's too many training sessions we found, but we've had to individualize. And when we found an area that we can't find training on, we've actually brought somebody in specifically to have a look at that training for our social prescribing, because I think it's quite a unique job, really. I don't think there's anything quite like it out there. There's jobs that do similar things, but I think it can be such a vast breadth of what they have to cover with a young person that sometimes you don't know what you don't know. Does that make sense?
No, absolutely, completely agree. I think definitely that peer reflection and time with other social prescribers has been invaluable for everybody to learn and grow together. But also, like you say, just being able to kind of recognise kind of where staff feel confident that they can share that with other staff, but then also where there's kind of themes that staff are saying, actually, we don't feel as confident in this, trying to find training and put it on. So again, our staff have done a whole variety of training linked to kind of specific themes, some very much like you've mentioned in terms of that mental health and well-being, around self-harm and suicide. And then neurodiversity as well, I think obviously is because obviously that link with well-being, and the fact that a diagnosis doesn't always then give you strategies and skills to manage in the world, and to kind of work out how you connect to a community when you feel slightly different to it. So I think it's been really helpful for staff to kind of consider that through a young person's lens and through a neurodiverse lens, so that they can tailor, again, that individuality comes back into it, that person-centered individual response to a situation. I think that's key to supporting staff and key to supporting young people, really, isn't it?
It really, really is, yeah. And I mean, we're very lucky because we've got we've got, like I say, Matthew's Hub, where we've been able to go on training for that. But we've actually also got some of our staff have done a diversity of roles and diversity of training themselves, so they've been able to bring training themselves to other members of the team and offer sort of like support and advice. But I think it's also having that time at the end of the week, I don't know if you agree, where you can check in with each other just to make sure everybody's all right, so that they're not going home with concerns and worries at the end of the week. You know, we've got like a buddy system. I mean, there's so many different ways you can do it, but I just think it's so important because it can be quite an emotionally taking type job where you're giving an awful lot emotionally. So just having that opportunity to sort of like discuss anything that's worried you, I think is so important at the end of the week. So you can have your downtime on the weekend or when your working week finishes, and not going home worrying about things.
Yeah, and I think that's really important, particularly in a social prescribing role, because it is a slightly more short-term role. So we have other roles within our organisation that are more longer-term interventional led. So you see that journey for the young person, you kind of take them to their outcome and their end goal. Whereas sometimes, quite often, the staff will describe social prescribing as a stepping stone. So it's this next step to connect them to kind of achieve their goal, but it doesn't always ultimately achieve its goal within social prescribing. So that kind of not wanting to take home with you and not wanting to kind of overfix a problem for a young person, and leaving that ability for them to be empowered to kind of make some choice for themselves, and to recognize that actually it's really valuable to make that connection for that sustainable resilience. But it doesn't always mean that in the role of social prescriber you get to know the end of the story.
Yeah, you can't fix everything as a social prescriber, as they say, can you? You are a huge part in their journey, and you start them on it, which is often the hardest step, I think, sometimes.
Absolutely.
I know some young people have fed back to us that when they've actually really seen the benefit of talking, and that's then allowed them to go on and see the benefit of counselling or working with mental health services, which before they wouldn't have done, because they just thought, who's going to listen to me?
Yeah, and that's really powerful stuff, isn't it? That's a huge change, that'll make a difference into their future.
And that leads me on nicely to ask you, what kind of outcomes do you see as a social prescriber? What do your team see as the outcomes for some of your young people that you work with?
Yeah, so I mean, our main outcome is that connection into community provision. So I think we're on to about 48% actually join a community service. So whether that's a youth service, open access group, a girls group, football, rugby, there's a whole list of kind of community activities that they then are connected into. And then young people always talk about, like you say, it's that being seen, being heard, feeling able now to be able to talk about their problems, feeling better understood. So we've had young people that have been school avoiding, that have been able to re-engage and feel kind of, actually, do you know what, I could get back into education, I can do something about this. We've had young people that were a bit worried at the end of year 11 about what they were going to do next, and have been able to move into college courses. So a real variety of kind of impacts on well-being, but also feeling physically brighter and happier as well, just because they're getting out and about. So we had one young person who was anxious, feeling like they didn't have anywhere that they belonged, so spending a lot of time in their bedroom on their own because they just didn't have any sense of connection or belonging. And social prescribed them, supported them into a group, and they still attend now 9 months later, and they love the group. They say that their friendship group is based in that group, that they've got a real strong cohort of friends from it, that it gives them something to do that otherwise they'd just be sat in their room. So it gives them that kind of outlet to be themselves, and experience all that comes with having a friendship group and being part of activities they within their group. They've gone off and like celebrated all sorts of events, consultated at regional meetings, and done all sorts of different things.
Wow, that sounds really empowering for them. It's given them a voice, and it's probably made them feel heard in so many ways, and feel so not powerful, but so much that they're important, and that must kind of improve their confidence. I have to say, we've had some very similar success stories. I guess the other thing that we found is that we've been able to support young people when they transition into adult physical health services and mental health services, often because that's quite a big bridge, isn't it, for going from paediatric services where you get really looked after to suddenly you have to navigate this world of adult services yourself. And I know we find so many young people drop off the radar from health services. I mean, can think of one in particular excuse me, who was having problems with epileptic fits, and our social prescriber was able to speak to the consultant and the team and get them back into being able to see the consultant regularly. We put an action plan in place so they could go swimming safely, and just sort of they described it as almost getting their life back, really, because they felt confident and able to sort of like ask for the help when they needed it, and was able to do the physical activity that they love doing of swimming again, because they'd been frightened before of going swimming on their own, because it's totally different when you're an adult out there going swimming than it is when you go with a whole group of school kids, isn't it, really? So I think just some really, really powerful feedback from the feedback we get from young people about the impact that social prescribing has had on them.
Yeah, that sounds really powerful. And it's that bit, isn't it, that actually the again, it comes back to that stepping stone and that journey. And it's so varied, isn't it? I think the outcomes of social prescribing, but it's also not criteriaed, which I think is really important. So all these amazing outcomes, they're young people from all walks of life and with all different levels of support needs. So it's that bit that it can happen alongside long-term health conditions and support people to kind of live healthier, happier lives, and manage their conditions. I mean, we don't do crisis support, but anything else where kind of where young people are kind of getting help with more complex mental health or physical health needs, we'll work alongside it and kind of have a think about, well, that's one aspect, but what about the rest of you? That diagnosis isn't just who you are. What about the rest of who you are as a person? How can we support you to feel more happier, confident, and achieve the goals that you want for the rest of who you are?
Absolutely agree on that one. Yeah, we don't do the crisis stuff or the acute mental health stuff, but we work alongside services that do provide that, but for both physical and mental health services, and we'd like to think that we can support them to stay well in all other aspects of their life, so that doesn't get forgotten, because often, as you describe, a young person feels that they become that mental health illness or that physical health illness, whereas in fact there's no reason why they can't thrive and be fully linked in communities and have a full, totally fulfilling life outside of the health issue or the mental health issue that they might have. And I think sometimes it's refreshing for them to be seen as a young person, not as a condition.
Yes, absolutely. Yeah, and that identity is key into at that children and young people's age. Is so crucial to forming identities and feeling that those feelings of belonging and confidence in self. So, as you know, I mean, research tells you that so many health conditions and mental health and outcomes in adult life are set before you're 18. So to really support young people at that point, when they're really forming who they are and giving them the confidence to both explore but also feel safe in who they want to be, I think is a real privilege.
I would totally agree with you on that one. Yeah. So thank you very much for today. It's been really good to talk about children and young people social prescriber, and thank you for anyone that's listening to this.
Yeah, thank you. I hope you've enjoyed listening to it as much as we've enjoyed talking about social prescribing.